Good morning. We will call the meeting to order of Tuesday, September 24th, 2013. First item on the agenda is the approval of the agenda.
Move to approve.
Second.
Discussion? All in favor say aye.
Aye.
Carried. Is there anyone in the audience who would like to be heard on anything that is not on the agenda? Okay. Now we'll pay the bills.
Second.
All in favor say aye.
Aye.
The bills are paid. And now we have with us Stacy and Lynn, a request for certification of easements for wildlife habitat protection in Section 34 of Tansom Township. Welcome, ladies.
Good morning.
Stacy and I are here this morning representing the Fish and Wildlife Service. We have two habitat easements that have been signed, one by Valerie and Christopher Howard. They live in Napa, California, and the second one is by Arlen and Rebecca Anderson. If you notice on the maps, these parcels actually are right by each other. They're connected. The Valerie Howard tract is 40 acres. That will be a hay habitat easement, which means they'll be able to hay the property after July 15th every year. Arlen Anderson decided to go with a grazing easement. That means he can graze the property at any time of the year. There's no limit on the number of animals, etc. So, as you know, our easements are perpetual, and that means that once they're placed on the property, they continue that way. The Howards, even though they live in California, they have a son who lives in North Dakota, and they don't want to sell the property. They want it passed down for his use and his children's use. So both of these properties stay in private ownership, and the landowners continue paying the taxes. So are there any questions you have for either Stacy or I?
Anybody have any comments or questions?
Sounds like a win-win.
We're glad you feel that way.
Yes.
I'm just curious, so did they come to you for this, or how did that work?
Do you know, Stacy?
I think there's some history there. There's some tracks in the Ottertail County area, just south of them. They've been working with the Fish and Wildlife Service on some habitat restoration, and some of the landowners on both sides of the fence have been working with us. So I believe that everyone came to us.
Our program is a lot of word of mouth.
Yep.
And actually, Arlen Anderson and his wife, they own property just south of there in Ottertail County. I'm also working on two habitat easements with them on their Ottertail County property. So it's where I'm working on three at one time with them. So it's mostly word of mouth, our easement program.
I'd move approval of the request.
Second. Discussion. All in favor say aye.
Aye.
You got it, ladies.
Thank you guys for your time. We
Yeah.
appreciate it very much.
I have some sheets here
Okay.
that you, as the commissioner, you keep one and sign the other one. One I get back and one you keep.
All right.
There's two for each, two for Howard's and two for Anderson's. He signs one and gives it back, and you guys just keep the other one for your records. So
You
there's,
want one copy of this?
right, yeah, one back of each.
Brian?
You want to sign one back, of course.
Right, yep,
Sign one, then.
Yeah, why don't we sign one?
under the certified for acquisition, or, yeah, part.
Just one copy.
Yeah.
Okay, there should be one for,
Yeah, you got to sign all these.
yeah,
Oh,
They're
How
not
many-
for us.
how many copies do you need signed?
I need one for Arlen signed and one for Valerie Howard, because there's two different properties, so I need one signed for each.
And there's one for our files.
Yes. I know it's confusing, but, the federal government, we have lots of paperwork, just like everybody else. It's getting cloudy. Is it going to rain today? Could use a little rain.
Sounds like it wasn't much jam paper, huh?
Yeah.
A little sprinkle maybe.
Fizzled away as it was coming, so.
So all the sheets you passed down needed to be signed, is that correct?
Yes, and two, you keep two, and then I take
Okay.
two back. Perfect, thank you very much.
Thank you,
Thank
ladies.
you, take care.
Clay County's main lady, and Gina, you're on. Resolution of support of merging the Clay County Board of Health with Becker, Otter Tail, and Wilkin County Boards of Health into one community health board. And this has been going on for some time, hasn't it?
Good morning. Yes,
Yes.
it has been. We've
And then
been,
when this is done, I have a question for you.
okay, well, and you, this board knows as you approved this back in, I think we started the process in 2010, so it's been a long process of studying what we can do in public health for the future, how we can work more efficiently, more effectively, and all of that information. We've apprised this board as we've moved along in the process. We also have a committee that initially, there was a member of this board on that committee, and now Commissioner Gross has served on that committee as well, and Mr. Berg. So we've had the committee that's worked on this process and have studied all of the information. I know Commissioner Everett even attended a national training as part of we're part of the grant process with the Minnesota Department of Health in looking at nationally what's happening with public health. So we are at a point now where we are asking the boards to adopt and approve the resolution. We aren't at a place where we can make a final determination on the joint powers agreement. We're working on that. We're working on the details of that with MCIT and the Minnesota Department of Health. So that process will be moved along. We need to provide an intent to change the Community Health Board a year in advance to the state. So our plan is to make that recommendation to the state January of 2014. So then we have a year's time. What would happen is the Clay-Wilkin Community Health Board would be dissolved, and we'd enter into the four-county. If all four counties agree to move into this, there has been approval at the Otter Tail County Board to move ahead, and also at Wilkin County Board. Becker County's board, I believe, is meeting on this same thing today, and as well as this board. So each board has to decide individually whether they want us to continue to move forward and if they want to be a part of this process of working together as a four-county community health board.
Okay. Any comments? Oh, John?
Well, I think this is a good move. I would move the resolution.
Just a question, and maybe Jenny can chime in here too. But certainly, I agree with John in his making of the motion that it should be a good thing. But the devil will be in the details of the joint powers agreement, right?
Correct.
So this is still just moving this thing forward. Ultimately, it isn't finalized till we have an established and agreed upon joint powers agreement, correct?
That's correct.
Okay, so that, I just wanted to clarify
Yes.
that is yet to come.
That's
and
correct.
By us going today isn't finalizing that, yes, we are going to be a part of this.
Right, it's just agreeing that it's agreeing that you know, we can still
We would
move
like to do it.
forward. Correct, and then we are still working on the joint powers agreement. The four public health directors will be continuing to work on that. We're working on operational agreements, all of those details, so that will still have to be approved. The joint powers agreement will still have to be approved. That's not the request today, correct?
Further discussion?
Just one last question. So Commissioner Gross is a member of that committee that's researching this. Do you have a commissioner that's going to be from each county that will be involved with the discussions in framing the joint powers agreement?
Yeah, the committee right now does have a a commissioner from each county, and also a county administrator or someone in that capacity, and then the 4 public health directors and the 2 nurse consultants from the 2 regions for the public health departments. So that committee will certainly review and has reviewed. Commissioner Gross and Mr. Berg have reviewed the draft of the Joint Powers Agreement at this point, and so there will be a final Joint Powers Agreement as it comes down the road. We're working through some details yet on that.
Very good, thank you.
All in favor of the motion, say aye.
Aye.
Motion is carried. Thank you. Kathy, could you give us an update on the flu season situation regarding what Clay County will be doing regarding flu shots, if anything, this year?
Well, when we have the wellness screening in Clay County, which we have every year with Lakes Country Co-op, we will be offering the flu shots at that time for employees and maybe any family member that could come in. After that, we're setting up a schedule now, currently, we do have all of our flu vaccine in.
Good.
So we will be setting up a schedule as we normally do.
But to date, it's not a huge emergency across the country like it has been in past years. Is
Well,
that correct?
No, the flu season is always significant, but they are recommending that you start vaccines now.
Okay.
So we're going to be actually we have some dates already set up, but we're setting them up. Currently you can get your flu vaccine right now.
Thank you.
So,
Appreciate
And
your
that's
input.
for the public as well?
yeah, they'll be setting up some vaccine clinics for the public, yes.
Thank you, Kathy.
Okay, thanks.
Next is resolution in support of Metropolitan Food Systems Plan. Wade Klein from MetroCog and Gina Nolte. Would you two like to come forward and turn it over to whoever wants to start?
Let's see, we have a PowerPoint here. I do have a copy of the resolution. It sounds like it may not have been in the packet. Okay, well, while it's warming up, I'm going to just start.
Does that help?
Yeah, it helps.
No, it does.
Yeah.
I don't know if it helps the TV camera, but it helps us.
That's true. Okay. Well, Wade from MetroCog, Wade Klein, Executive Director of MetroCog, and myself, I'm Gina Nolte with Public Health. We are going to present a little bit about the food systems plan that you have in your packet. And we're looking today for a resolution in support. Sorry about that. Looking for a resolution of support of our food systems plan. So first of all, I just want to talk just briefly about food systems. What does that mean exactly? And it is a complicated thing, but if you think in terms of it, when you're actually eating something, all the steps that got to that point, from the farmer to the distributors to the processors and sales, marketing, consumers, handling of waste, and transportation is throughout. So we know it's a very complex system. Even though we take it for granted, every day we're eating all day long if you're in my situation. So the next area I wanted to focus on is that it is a complex system as well. There is the ecological infrastructure and food safety. There's the opportunities to grow people's own food, and there's education, there's social equality and social justice kinds of issues. But do we have those questions answered? Is our food system sustainable? They're talking more about, from a food security standpoint, do we have what we would need in case something happened? Would we be able to feed ourselves and our community? Do we have the infrastructure for local growers to process foods and to get it to the buyers? Is our food safe? And can people, if they want to grow their own food, is the policies and systems in place to do so? And do we know how to cook? Do we know how to use that food that we grow? And do all populations have access to healthy, affordable foods? So with that, and there's been a food movement. I'm not sure how many are familiar with that or heard some of the things going on, but local food and access to healthy food has been a movement that's been growing over the last few years. I'd say that we're doing well in moving that forward compared to some communities, but it is definitely momentum in the United States and throughout. In 2010, Public Health and Extension, and I have some of my colleagues are here today, we formed a steering committee to develop this process. And we've been working on that ever since, been engaging other people in this process. But the initial goal set was to increase access to safe, nutritious, and affordable food for our residents by strengthening all aspects of the local food system. And even Fargo, in their comp plan in 2013, did food systems came up, and local foods came up as one of the priority areas. So as far as this process with our developing our Cascade Food Systems Initiative was to engage the broader community. So we had our steering committee, then we had a broader group of people working on this, and that was farmers, grocers, social services. We had a large group of people that kind of narrowed it down what the focus might be and what the further defined the direction that we wanted to go. And with that, then, we took it to a larger group in September 2011. We had a conference, and I think a couple of you were at that conference. We had the ag commissioners in both states. We had somebody from the USDA here. And then we had a process where we kind of took that information that the planning group had put together to kind of further define where we were, what the goals were, what the needs were, and what the community wanted to see. And so today we have three task force groups that are active. And we meet 3 times a year as larger groups, and everybody's invited to that. But our task force are urban ag, economic development and / infrastructure, and then food access. So it's been an active group. With that, we've been, because transportation is a big part of that, and a number of goals that are related to MetroCog, it's worked very well for us to partner on that. And so with that, I think I'll turn it to Wade.
Thanks, Gina. Kind of a little bit of background. I think Gina hit on kind of the high elevation stuff, but I think a little bit of background as far as, how do we define local food. I think it's something that's a little difficult to kind of get our hands around. And I know when we first got involved in the topic, it was something, newer to myself and newer to a lot of the planning community here. But if you look at what USDA defines as local, I mean, they're looking at product that's basically grown, approximately 400 miles from where it's consumed. So whether it's, apples, tomatoes, pineapples, beef, pork, whatever it would be, the USDA is saying, if it's 400 miles from where it's consumed, that's probably a local product. So if you go to a grocery store and you're buying, maybe some hothouse tomatoes that are coming from DL, I mean, you'd probably define that as a local food. But in a lot of cases, you can define local conditions differently depending on where in the country you are. Your growing seasons are different, so on and so forth. But what we tried to focus on with this food systems plan is really looking kind of at the marketplace. I mean, that's really where the rubber hits the road in terms of local food and trying to increase the consumption of local food, local healthy food, and there's really 2 ways of looking at it. I mean, there's kind of a direct-to-consumer approach where, typically if you're buying quote-unquote local food, I mean, you're going to a farmer's market or you're subscribing to a CSA, a community-supported agriculture, where you're getting a box of food every week or so. So really the consumer and the producer have a direct relationship, whether it be at the market or you're getting a box through a CSA. The other piece of it, and probably more complicated, is sort of the direct-to-retail or direct-to-service. I mean, that's where the producer and the consumer are separated by either a retailer or a service establishment. You have an institution like a school district or a county government where they're basically buying from the producer, serving it in the cafeteria, serving it to their customers, and the consumer is getting it that way. So there's really 2 ways of looking at, local food and how do we get it to the market. And that's kind of the overarching piece of the food systems plan. So when we look at the local food system, we kind of look at a couple of factors from the planning perspective is, do we have the appropriate conditions to produce local food? And like anything else, I mean, a lot of the production of local food is, somewhat inefficient. We'll talk about some of those inefficiencies. But also, aside from production, I mean, do we have adequate marketplaces? I mean, a lot of times, as you get into the harvest season, you'll drive down Main Street and, there's the fellow with the corn and there comes the tomato stand. But are the markets adequate so that if you do have production, I mean, are they able to sell their product? And then thirdly is, what kind of consumer demand do we have? I mean, is the public aware that, these products are available, they're safe, they're good for you, those kinds of things. So it's really the three pieces, again, kind of looking at the marketplace, looking at the exchange of the product. One of the first things, as with any kind of planning process that we wanted to do, is kind of start to take a look at some of the issues. And we looked kind of at the national perspective and then brought it down to the local perspective. And I think a lot of the national issues we heard when we had focus groups, met with the stakeholders. We actually had a public input meeting in March that was fairly well attended. I wasn't sure how many people we would get, but we did have a good showing of a pretty good cross-section of the community. And I think what we hear is that, like Gina pointed out, I mean, nationally there is a movement where people are kind of interested now. You're reading a lot in the newspapers about, salmonella and where is this product coming from. So there really is a concerted effort from the consumer's perspective in saying, hey, if there's a possibility here that I could buy something locally, I'd like to do that because I know the grower, I know the farmer, I know they have a good practice. And secondarily, one of the issues that is pretty much prevalent is the inefficiencies in the distribution system. I mean, a lot of these people who are growing and producing, I mean, they've got, some hoses and a pickup truck and a little bit of land, and you think about how we typically create food, it's industrialized, and it's to the point where the inefficiencies are there because it's supply and demand. Well, when we start talking about local food production and distribution, it's very inefficient from sort of a modern 21st century sort of economic books approach. The other issue that comes up, and I think this is part of why you see a lot of public health involvement in this, is that there's a real issue with food insecurity. I mean, we do have populations that have difficulty accessing food of any kind, and I know there's a lot in the newspapers now about what Congress is doing with the SNAP program and food stamps, and a lot of that plays into this because we do have populations that we know we need to make sure that we're getting them access to food, and this is an opportunity potentially to get them access to locally grown healthy food. The fourth piece, which I think is interesting, really looks at, do we have what has naturally been called these emerging food deserts? I mean, when you start to take a look at some of the demographic data, and if you look at our metro area in particular, I mean, where do we have concentrations of low-income and minority areas? Where do we have, households that maybe don't have access to an automobile? Where do we have our transit systems? Where are our grocery stores? And you start to overlay some of that data, and what you're looking at here, those red areas, would be what we would basically say, from a preliminary perspective, might be emerging food deserts, where you've got the right kind of populations, the right kind of economic conditions, that you don't have a grocery store in half-mile proximity, and transportation issues may be an issue. And a good example I could put on this in sort of the Moorhead-Clay County would be, right here on the north side, I think around 2006, you had the Sun Mart close. I mean, that had been a grocery store, Piggly Wiggly. I mean, we remember that has always been a grocery store. Well, when that grocery store closed, now if you live close to the tracks, of course, you can walk over to Hornbacher's, but as you get closer to this side of town, your nearest grocery store now is getting a bit distant. So you see up there, I don't have my highlighter with me, but the north side of Moorhead would probably fall into what you might consider to be, an emerging food desert, because you aren't necessarily all that close to a grocery store. And I know when that grocery store closed, it reverberated, say, for example, on the transit system, because now you had, north side bus service had to be realigned so that you could have a bus route on the north side that would provide direct service to a grocery store. That's just the way MapBus likes to operate. So we've got these emerging food deserts based on some of our demographic and economic considerations. And one of the things the plan talks about, looking at those same variables is, how do we improve opportunities? So looking at those areas, are there opportunities to do a better job of working with corner stores to try to get, healthier products into them? You think about, coming home after school, you're 11, 12 years old. If it's dinner time and mom and dad aren't home yet, what's your nearest opportunity to get dinner? Well, if where I grew up, which is just a few blocks from here, I don't have, Piggly Wiggly, which I would have rode my bike to. Now I'm going to, Stop and Go, and those are great establishments, but that's probably not where you want to go and get the ingredients for dinner. So as we look forward, we want to maybe start to look at these geographic areas to try to figure out, how do we begin to build the food system in these parts of our community. So with the issues identified, one of the things we tried to do was give the plan some goals, and as I had mentioned, a lot of it had to do with improving production and distribution and consumption, and really starting to look at policies, and some of them are public policies, some of them are policies that we need to work with local institutions on to really begin to get a sense of what our framework is, and that really is, I think, the important word when you look at this plan, is that it really is a framework. There are certainly recommendations, there are certainly issues that are identified, but I think overall it gives, Clay County Public Health and the partners on the North Dakota side, an opportunity to move forward with a little bit more of a roadmap as to how do we want to begin to address this particular issue. Some of the benefits, and I think Gina talked a little bit on it, what are we trying to do? We're trying to improve access to food, not only local food, but healthy food. It goes back to the food desert discussion. We're trying to look at health and nutrition. I mean, that's really the underpinning of a lot of the new efforts of public health around the country, is that we're recognizing that, we're not as healthy as we used to be. A lot of that gets down to lifestyle choices. And so some of the underpinnings here is let's look at health and nutrition outcomes, as well as the food security issue. I mean, as public agencies, we are providing, whether it be mandate or otherwise, a certain amount of subsidy for people to make sure they have enough food, and part of this, I think, gets into the local food, if there's an opportunity to address food security through local food opportunities. And the fourth piece is important, too, and that's land use. When we talk about food production, land use is a big underpinning, and I know as a county board, we're always talking about, prime ag land and making sure that, the large producers have that preservation of really what is a lifestyle, what we've considered to be a tradition, and it comes into the local food planning process to make sure that, even as we get closer to the cities, do we have the ability to do, a reasonable amount of what you would call urban agriculture, so that we can produce food. It's not industrial style complex, but it's a kind of production that is not a nuisance to the neighbors, but that can be, generating product either for personal consumption or for sale to other populations. And the nice thing about this is we inherited from both public health departments a good set of data. And data is really important, I believe, in public health, because it gives us an opportunity to track and measure. So the report includes a number of pages of data sets on, how are we doing in terms of health and nutrition, how are we doing in terms of, farmers markets and the number of consumers we think are actually consuming local food, so that as we go forward, we can actually measure the success. And I know from a public health perspective, that's important, and I think from a county board perspective, that degree of metric and measurability is also important. So as we put the plan together, and again, we inherited a lot of momentum, from Gina and her partners over at Fargo-Cass, in terms of putting some target areas together, looking at economic development. That's a big part of this. Every dollar you can keep in the community is a dollar that's going to be spent somewhere else in the community, and I think that's a big part of it. The infrastructure piece of, do we have the infrastructure to really grow the local food system? The food access piece I think I've hit on. The outreach and education is a big part of it, too, and a lot of what we've heard from consumers is that the consumers aren't necessarily always aware of what's available. They're not aware that, there's a number of places you can get, good locally grown beef, good locally grown pork. We're all aware of the farmer's market, and even in that case, folks aren't necessarily aware of what's available when, because if you didn't grow up on a farm, if you're not used to producing, you go to the farmer's market in June, you might be frustrated there aren't cucumbers, but if you know anything about the growing season here, you're not going to find a good cucumber probably in June. So there's a lot of education and outreach as to, how does food get produced, and, what seasons is various food product available. The urban ag piece, I kind of touched on that, trying to find improvements so that we can improve local food production, particularly in the urban context. And then the other piece that I think is important is the policy and governance piece. We probably need to move towards more of a coordinated system. Like anything else in our communities here, what one community does affects another, and so we need to try to come up with a framework for that. But more importantly, I think the piece with policy and governance is that if you look through all of our local zoning ordinances and our comprehensive plans and our economic development plans, one of the things that you're not going to find mentioned, other than perhaps the recent plan in Fargo, is food. We worry about roads, we worry about sewer and water, but we don't really address food when it comes to our local conditions, and that's something we probably need to start to look at a little bit more closely. So I'm just going to speed through a couple more here, and then we can kind of open it up for questions. When we start looking at implementation, with the economic development piece, it's that corner store initiative. I stopped and got a soda on my way over here. Actually, it was one of those energy drinks. But you've got I don't know. It says caffeine on it, and I think that's the operative word here this morning. But, where do we have corner stores? Are there opportunities to use these as outlets to get a little bit, healthier choice? You can still get your Snickers and your soda, but, you've got residents that depend on these stores. For example, we used to have the old Shop and Wash, over off of 17th Street. Well, that's a retail outlet. Is there an opportunity to try to make that a productive retail outlet, to sell what you typically get at a corner store, but, maybe you get some eggs and some milk and stuff in there as well. Looking at a food hub and food cooperatives, I use the example of if you go home for Thanksgiving, you go into the small town, what does it say on the side of the elevator? Co-op. Well, there's a reason that we had co-ops. It's because Grandpa and Grandma found that it was easier to get together with other people so that you could, get your product together, aggregate it, distribute it to the marketplace. And I think when we start talking about the modern context of local food, that concept of a co-op is pretty critical. People need to cooperate, and right now there's just not a tremendous amount of it going on. And a good example would be the farmers market. A lot of people don't realize that the farmers market that goes on at the Midtown area there down at the dike, there's two different groups, and those groups don't necessarily even get along. So, you kind of see the underpinnings here. Nobody in this group is going to have a monopoly, and if we're going to be successful, we kind of need to sit down and say, okay, who's got what cards here, and how do we play them so that we can all be successful. Talked a lot about the food access already, but the implementation piece of this is really, making sure that we're getting access to some of these vulnerable populations. We've had success with getting the SNAP programs accepted at farmers markets. If you can use your SNAP benefits at Hornbacher's or Sunmart or Cashwise to buy vegetables, you should be able to maybe have that same choice if you're going down to the farmer's market. It's the same product, but instead of supporting, a farmer in California, you can support, a farmer from Cragness. And so how do we begin to, integrate that kind of policy? And there have been successes within the region where that is concerned. The infrastructure piece is important. The food processing, the aggregation, the distribution, those are all important concepts that I think I've already hit on. The outreach and the education. We need more marketing where our local food system is concerned, not only in terms of what products are available, but how do we begin to get people aware of the benefits of local food, that the fact that these products are safe, and working to get some of these programs into our schools so that kids, a lot of kids today don't really even know where food comes from. They wouldn't even know, seed, dirt, water. So a lot of that just goes back to the principles that we've kind of forgotten, as a culture, that we need to make sure that our kids are aware of, how do these foods reach the marketplace. The urban ag, I've kind of touched on that. I think a good example for the county board in terms of urban ag would be the Propsfield operation there. You've got a functioning farm that in 2015 is going to be in the city of Moorhead. So, that's a really good example of, do we have the public policies in place so that when you take something that's currently, in the county is now going to be in the city, do we have the kind of policies to allow for those kinds of things to go on? Is it a nuisance? Probably not. It's kind of a rural context. They're producing some products. So, that's a very good example of, that urban ag and making sure that we've got the flexibility to allow for, heritage kind of operations to continue, but also if somebody is in a rural urban context, can they open up something that isn't going to be a nuisance and is going to be able to operate going forward? The last piece, as with anything else in this community, if we're serious about moving forward in a food systems planning perspective, we probably need to begin to look at, more of a formalized technical group I mean, there's been a lot of informal discussion, and, much like, MapBus, much like a lot of public utilities, we probably need to look at some kind of more of a formalized structure so that, as we're making decisions as a group of communities, as a group of public health departments, that we can do it from kind of a platform. Now, what that looks like when it gets implemented, I don't know, but I think if you look around the country at other regions that have been successful with food systems, I mean, they certainly have kind of a pivot point for trying to address the food systems approach. So I know I kind of went through that, pretty quickly, but would be certainly happy to answer any questions and see what the board has on their mind here this morning.
Gentlemen?
I would have a question as far as all these farmers markets that are opening up. Do they have to be licensed and stuff like that? Do they have to go into any program, or can I just set up a place? Probably this isn't involved in that yet. I don't know. Am I asking some other things that? I mean, what prevents me from going to Cashwise or Walmart to buy a truckload of corn and setting up a spot in the corner? I mean, do I have to say that it was locally grown, or?
No, I don't think that's one of the things right now is we don't have many policies or practices related to that. So I think you could go and buy something and say it, don't you think?
Yeah, and I mean,
there is any policies on that at this point.
Yep, and we did take a look at, the back of the plan. We kind of went community by community, and so we did look at the county code, and it does make provisions for farm stands or roadside stands. So the code already does address, what is and what isn't, a permitted use or a non-permitted use. But that gets at, Frank, kind of the underpinnings here. We need a very clear perspective as, at what point do you probably need a permit, how big is it? I mean, as far as getting like a public health permit or that kind of a thing, I mean, I think as long as you're following the code, you're good.
John?
I think the emphasis often is on the importance of knowing your farmer, knowing the producer. And I think that's going to solve that problem more than anything. I mean, if you know who's producing the food, then you know where they're producing it and how they're producing it. Yeah. And that's the important thing I think that we need to strive for. If we really have a secure local food system, it's going to require that there's a relationship between the buyer and the producer.
Yeah, that may be true, but when I see a pickup parked in the corner, we just don't know who.
That's true, yeah. Unless you get to know them and find out where they produce it, you're not going to. I mean, I always ask that when somebody's producing something or selling something, where it's produced, where it's grown.
Right.
How about you've got no funds are requested at this time. Do you expect in the future that you'll be coming to us for some funding for this? Or?
I leave the door open. But I think at this point, what we see is if we're more formalized and working together as several jurisdictions, that we have an opportunity more to seek funds to grant funding. So I knew by putting that down that'd be a question, but.
We have a resolution they would like.
There's a lot of really interesting things that you've brought up here, and a lot of them are really good. And when you start talking about even creating maybe more sites within the city limits for growing, that itself can be a good idea, and it can be controversial. And I'll give you the example, Wayne. If I went to my neighbor and said, I'm going to go out and I'm going to plant 3/4 of my backyard for cucumbers so I can eat them because I like them, but I want to sell some, I might get a positive response. But if I tell them I'm going to raise chickens, I might get a different response. So, so you get that thing. There can be difference in what vegetables are and when you get into animals. So when we're dealing within town, you brought up Probstfield. That's been a really interesting and a good deal, and it's been successful in a lot of areas and in some parts challenging. And I'm talking about the community gardens there, where they've had opportunities for people who can probably afford less food to go there with opportunities to raise their own. And that works. And as far as being in the city, I think that one, that there's been discussions on that as far as the city zoning and how that's going to work. So I think working with the city. I think this presentation should maybe go to the city government as well. Not only this city, but all the cities in the county, because this is going to be a county-wide effort. So, but overall, there's been a lot of work that's gone into it.
I move to approve the resolution.
Second. Discussion? All in favor, say aye.
Aye.
Resolution is carried. Thank you.
Thank you very
Wade?
much.
Thank you.
Pete? Next item, elected officials enrollment healthcare savings plan. Darren, you want to come forward? And I know you have some department heads here.
Good morning.
How are you doing?
Good. Okay. Well, back in, I think it was August 13th, I brought this to the board for discussion. It's regarding the healthcare savings plan that the elected officials, and right up front I want to differentiate between elected officials, which is our auditor, treasurer, recorder, those guys, and county commissioners. So when I say elected officials, I'm talking about those 4 people right now. And so on August 13th, I brought this to the board for consideration and discussion. And a very quick background on this would be in 1992, the law was changed to not allow elected officials to accrue vacation and sick leave. In 2008, the law was changed that said that elected officials are allowed to participate in a healthcare savings plan, but it couldn't, a lump sum payment could not be tied to a termination. And so from that meeting that we had on August 13th, I was asked to go back and find out a little bit more information on that. The original proposal that I brought to the board on the 13th was that because of the law change and because we thought that the elected officials were kind of, the rug was pulled out from under them in 2008, and that we didn't even find this out until 2012, that they would be entitled to a lump sum payment on based on their number of years of service, and a lump sum payment if they were to leave. And then also a $500 a year county contribution, and then a $500 individual contribution to the healthcare savings plan. Since that time, we've met, the county administrator and I have met with the county elected officials again, and we met with the PIC committee one more time last week, and basically made a proposal that we would continue with the lump sum payment, but not do the county contribution of $500 per year, and allow the elected officials to contribute their own money of $500 a year, which would come out to $19.25 per pay period into a healthcare savings plan. And so that's kind of why I'm here today, is to have a discussion on if that would be a feasible proposal for the board, and also answer any questions that you may have regarding the healthcare savings plan for the elected officials.
This has been through the Personnel Issues Committee,
Yes, it has.
and the 4 elected officials are in favor of it.
Correct.
Thank you. Any
Correct.
questions from the board?
What is the total cost to the county?
What I did was I based it on the years of service that they have done. And when I talked to the Minnesota State Retirement System Healthcare Savings Plan representative, they said that you can do a one-time lump sum payment not to exceed 15% of the elected official's salary. Only one of those elected officials fell into that category, where for the number of years that they've been here, their lump sum payment would have been more than the 15%. So the bottom line is 3 of the elected officials would get less than their 15%, and the one would get the 15% of the annual salary. The final tally of the lump sum payment would be $27,711 for a total of the 4 elected officials.
And Darren, this is a one-time situation, too,
Correct.
right? The
This
lump
would
sum
be-
payment. So in the future, this is for current
Correct.
people in those positions, and it's basically something that's been in place for many years, and the law changed in 2008. So now we have that one-time lump sum payment to make them as whole as possible, and then in the future, for future elected officials, that wouldn't exist.
Correct. The only change would be that once the elected officials came on board, they could start contributing to the healthcare savings plan right away.
But that would be their own.
Exactly, that would be their own money.
Yes.
There would not be a county contribution after this one-time lump sum payment for the current elected officials.
Further questions?
Yeah, Darren, how does the, and I spoke to the issue back in August in terms of my feelings on it, and it was that, and I still feel the same way, those people felt all along that this was part of their compensation package.
Correct.
This was something, and the state legislature took it away, and basically none of us recognized that they had done that.
Correct. That was done in 2008.
Yeah.
And it was more of a, in my opinion, after researching this a little bit more and asking some of the people at the Minnesota Legislative Library, Reference Library, that it was more of a clarification in 2008, basically saying who could and could not participate. And so it said that it basically changed it so that elected officials could participate in the health care savings plan. But the law that stated that they could not accrue sick or vacation was actually implemented in 1992, was the law change for that.
Then I just have one other question, kind of outside of this a little bit, and it has to do with the future abilities for those individuals to put $500 into a health savings plan, right? Because that's what we're talking about.
Correct.
The ability to
Correct.
continue.
Correct.
And that could be for future elected people
Yeah,
as well.
if somebody, and that would be what is a formed group, basically,
Right.
of elected officials, that everybody in that group would have to participate.
Okay, now, this is where my question, I know in our insurance committee group, we are looking at adding this other plan, which is a HSA/VIBA.
Correct.
Now, would those dollars go into that plan?
No, this would be a separate, this is a separate entity.
And is that
Yeah.
legal?
Yes, you can have a healthcare savings plan and a HSA
HSA?
VIBA. There may be some stipulations on what you can and can't use the money for, but the healthcare savings plan is basically set up like almost like a VIBA, where you have to use it for medical items, and you can use it for premium payments as well after you retire or leave employment.
So they would have the choice of whichever
Correct.
of those two plans is in their best interest.
If they decided to take a HSA VIBA, if we go to that plan eventually in the future. But the healthcare savings plan is kind of separate to that.
So as part of our responsibility here then, are we the ones who create this group for them, or do they create the group, or how does this work?
Basically, we would change the personnel policy to create the group for the elected officials,
Okay.
because it has to be in a personnel policy. We would then send that personnel policy to the Minnesota State Retirement System. They would agree that this is a legitimate group to participate in the healthcare savings plan. And so it would just be the board's determination on should this group be allowed to form and the lump sum payment.
I don't know if it applies or not, but I know we're looking at next year in Minnesota to change our elected officials, that they're no longer elected officials like think the auditor and the treasurer did or not. Would that affect that at all? I mean, they're in this plan now, and then now they're not an elected official anymore. How does that affect them then?
That's a good question. I never thought of if they become non-elected appointed positions. I guess I'd have to go back and find out from
I
them.
assume they would just withdraw from that group.
Yeah,
and move into what other appointed employees do, and then
It would be-
the remaining elected officials would still have the
Yeah,
group.
Brian would like to comment on that.
Well, Mr. Chair, they would retain the amount that's been the one-time deposited.
Yes.
And if they became appointed officials, then they would carry on as appointed officials, but they would retain that amount because that's been deposited in their
Thank you.
account.
yeah, they would retain the amount, but they would then start at, accruing their sick leave vacation as a appointed person. So they would be treated just like any other, they would get the sick leave severance when they would, depending on how many years they've been here and their sick leave balance, if they go from elected to.
So we're just trying to catch them up right now, or is that I mean, like, if next year they change to another plan, they don't have to pay back any of this stuff or anything like that? I mean, I just...
No, that would be deposited into their account, because basically we're paying them for the years that they were elected official,
Ron?
not necessarily the appointed.
And it's only the 4 elected officials, not commissioners.
That was the second part of of my board agenda item, would be, would the the commissioners want to form their own group as well with different criteria?
Let's act on this one first, though.
Okay.
Do we have a motion to approve?
I would move to approve the one-time payment for the current elected officials. And do we have, did we have to make a motion to have them set up their
Yes.
health savings too?
I think that would be part of it.
Include that in the
Yeah.
motion. and
Yeah.
also
To set up the group, you mean?
set up the group.
Set up a group.
Do we have a second?
Second.
Discussion. Kevin?
My former colleague on this board and still friend of mine, good old Mike McCarthy, would always ask the question, okay, where's the money coming from? And so because he's no longer here, I'll ask the question. And it's just, it's more of a process. I support what we're doing. And I know we had another committee meeting last week, and our administrator was hoping there a certain fund wouldn't be tapped into this year, but it appears to me that something may have come up that could be an eligible area for those dollars to be tapped into, unless you have another idea, Brian.
Brian?
Mr. Chair, those funds are being guarded as we speak. Well, this is very important, and Lori has, and I've had discussions on that. In fact, she had discussion at the committee meeting, that the accountability in the state audit report has been identified, though. However, and I'm looking at Lori because we do not have the dollars set aside for those.
They've been accounted for over the years in the financials, so I would just recommend that it will come from fund balance.
From fund balance.
Further discussion? All in favor, say aye.
Aye.
Way to protect his money there.
Motion is carried. Darren, the next part.
Okay, the next part is, and I kind of brought this up at the August 13th board meeting as well, is if the commissioners wanted to form their own group, join the elected officials group, or not join the healthcare savings plan at all. And so, I guess that would be up for discussion and a decision on which way the board would like to go.
The significant difference between what we just acted on with them and what would be for us is we never thought nor expected that we would get it. And based on that, I think we should just let that good dog lie and not do anything.
Well, this is, there's no lump sum payment included in this
No.
plan for commissioners, and so the only question is, do we want to form a group and contribute.
Your own dollars throughout the year.
But under our current plan, we basically have the ability to put extra dollars already into a health savings plan. Do we not?
You mean as far as like
Well,
a VIVA account,
yeah,
or
yeah.
if you have the VIVA plan, then you're getting your money into a health retirement account.
And we'd all have to, for this motion, we'd all have to agree. It's either all of us or...
Correct.
No, you
Yeah,
can't
all-
have three of us in
Correct.
favor of it.
The group would have to participate.
But whatever dollars would go there would be volunteer dollars of
Right.
that individual.
Right,
So
but-
then, if that's the case, I wouldn't care, I guess.
But it would have to be the same amount for everybody, right?
It would have to be the same amount for everybody, and everybody would have to participate.
Okay, at my age, I'm not overly concerned about, my retirement's pretty much been taken care of, and I'm sure a lot of people aren't here. However, I would certainly not vote against this if there's any of you who would like to have it, and I have no problem putting $50 a month away for, you go for the next 2 or 3 years, you go to the dentist, that's one trip probably. So I would be in favor of forming our group and paying in $50 a month. However, keep in mind, it has to be a 5-0 vote, or we don't have a group. Okay? That's my feeling. Grant, do you have a
Well,
comment?
I just move that we don't participate. I don't think there's that much interest in it, actually, so...
Well, and I'll second the motion just to discuss it, and again, it would be up to it's individual money. I'm kind of like Wayne in that respect. If I heard from the others that you'd like to do it, I'm not going to stand in the way of that.
But if we do agree to do it, and we say pick $50, you'd have to do it whether you want to or not, so if we agree to that, so...
But if we voted for it, that would indicate we wanted to.
Right.
I guess I kind of share Wayne's feelings that if John and if Frank wanted to have it, I don't care if they
I
take
agree with that.
$50 out of mine because it's going right back to me anyway.
I just feel that employee makes this their livelihood. I mean, this is their job and stuff like that. I don't think as commissioners we come on here for the health insurance or for the health savings plans and stuff like that. So, I mean, I guess at this point, I'm not in favor of it.
Good. All right, then that solves
Okay,
it.
any further discussion on the motion? Okay, we have a motion and a second not to have a plan. All in favor, say aye.
Aye.
Motion's carried.
Okay?
Okay.
Mr. Chair,
Brian.
just for clarity, so that the elected officials, the 4 elected officials, and the other department heads have clarity on it. This one time is to make right the former policy that was in place. And from this day forward, they are doing their own thing in regards to an HSA. And we will work through the semantics if there is a development of the appointed and of the elected positions.
Correct.
We will work through that. That's not set in stone yet either. But going forward, this will not be expected by the elected officials. Right? Was that your interpretation? I mean, that's how I interpreted it.
Well, it's the one-time thing, I don't know.
It-
Yeah.
In
a
other
one-time
words,
payment.
in other words, in 5 years, this won't be to be a catch-up or anything along that line. This will not exist beyond this point.
It
It would
basically
be
ends today.
That's correct.
It would be like the lieutenants and juvenile counselors that have their individual contributions to the healthcare savings plan through their contract, so it'd be similar to that.
Thank you, Darren.
All right, thank you
We'll
very
go to
much.
committee reports, and we'll start with Frank today.
I attended the FMCOG, and we pretty much went through the 20-year plan, some of the things that came up with the 20-year plan, and other than that, it was just the routine business, and so on what I had.
John?
Last Tuesday at noon, Brian and I and Dave Overble met with a couple individuals from, law office in the cities, Lockridge, Grindle, and they're wanted to talk about truck weights. And I was surprised when we were in conversation with them. They really came on the opposite side of the issue that I expected them to be on. They were representing suppliers to the railroads, and they see that increasing of truck weights as competition to the rail industry, and so they're lobbying against increasing the truck weights. Last year there was they had a motion, I mean a bill that would have increased all truck weights on state and federal highways to go up to 90. Was it 90,000, Brian?
Yes.
And that didn't pass, but there did pass a law that in Frazee, where Menards is going to be building a new distribution center, that they would have the increase weight limits allowed for them, which seems strange to me. But this group was lobbying against that because they see it as direct competition with the rail industry. So it was an interesting discussion, and I think we felt opposition to that move simply because that seemed very unfair to name one industry that was going to benefit, but also it certainly could do damage, continual damage to our roads. And it wasn't clear. It seems like it was only on state roads, so we'd still have to make exception on our roads for them. So it's kind of a complicated issue, and maybe Brian has more clarity on that. Anyway, that was an interesting discussion. There was Planning Commission that night, and probably the most interesting thing about the Planning Commission was that we acted on those campsites where the contractors were staying. Remember that came up at one of our meetings here, and we did approve those after the fact. I mean, they're already gone, but we did approve them the right to have set up temporary campsites for them. I presume next year it'll be an issue again, but we hope that the contractors were made aware early on that they need to line up places for their people to stay. We'd prefer they stayed in certified campgrounds like Steam Threshers or Barnesville Campground, or these places, rather than to set up temporary things in farmers' yards. So that was an interesting discussion. I did have a visit with Julie Ring, our new executive director of AMC. On the telephone, she called, I think, wanting to talk to all of the board members individually about things. And I'm very excited about her leadership. I think she's going to be just a fine leader for AMC. There was the executive committee meeting of the Red River Basin Commission on Thursday as well, and things seem to be progressing well there. Continued study of retention issues, as well as continued discussion about the diversion and how it affects others. Then that's all, I guess. That brings it up to today.
Chief? I think the only thing I had last week was the planning committee for financing the correctional facility that we're hoping to have in the near future, and I think we discussed a number of possibilities, and that actually look pretty good, and I think we'll have a plan in the not too distant future for some good ideas for financing a new jail. So, and we also talked that we needed to come up with a date for actually beginning construction on a jail, so we'll bring forward in the future. So.
Kevin?
Yeah, that's the only meeting I had last week, and I'm going to expand on that discussion because there was one recommendation that did come out of that committee, and that didn't have anything to do with the new facility whatsoever, but as a result of the loss of those beds, we had in our proposed in our budget the addition of that one correction officer in the jail, and after hearing further evidence from the Sheriff's Department and from Julie, and after looking at alternatives, we came to the conclusion to recommend to the board that that position stay in the budget, that we currently do have it in. It did pass through the preliminary budget, but we just felt it was important, and they need to start acting on preparing to get that position ready. for the first of the year when those beds are lost. So the committee did recommend to this board to keep that position in the budget for 2014. So I don't, they didn't expect any action from us today, but it was more of a, just an informational thing that they felt it was important to, or we as a committee felt it was important to present it to you today. There's several options and opportunities for us to look at funding options that we can target certain things without necessarily having a major impact on the, if we plan it right and time it right without having to go to the taxpayers for a lot of new money to pay for this facility. We've got several opportunities. Now there are, certainly it won't cover all of it, but when we free up other areas, there will be significant dollars there. And then when you look at the current costs that we're having to send out, the boarding will also be gone from the budget. That currently is getting higher and higher and higher every year. So when you add all of those things up, that'll pay a significant part of the construction. We still have a long way to go in that area, and we got to remember that when a new facility is ultimately done, the labor cost of that will escalate significantly. And we knew that from before, and we will still have to expect it. But I know we're going to be meeting again in a couple of months, and we're going to be presenting to this board some options to commit certain dollars that are currently going in other areas to when they're freed up to go towards that facility. And we'll have a good outline of that when we're ready. But all of this is significant in what we're doing in keeping the Department of Corrections at bay right now, because each year our ability to maintain and operate that facility is reduced. I mean, they're just clear that there's going to come a point in time when the DOC is going to say our facility is no longer operable, and we're not going to have any choice. So this isn't either or. This is either we're going to do it or we're going to ship 100 prisoners out every day. That's what it's going to come to at some point. So the planning does need to be done now. Yep.
On Tuesday, September 17th, I had the local advisory council for adult mental health, general business. There was a presentation by Marion Olson of the National Alliance of Mental Illness. The acronym is NAMI. There is now a chapter in Clay County, and their mission is to improve the lives of children and adults with mental illness. There were also several agency reports. Thursday, September 19th, Lake Agassiz Regional Library Board meeting, general business, financial report, and we acted on cuts to the library system. Others might come if certain signatories do not remit Lake Agassiz Regional Library's request. Brian.
Thank you, Mr. Chair. Just a couple things from last week. I did visit with Tim Dent in regards to the volume and the equipment that we use, and he confirmed that this is expensive equipment, it's good equipment, and it's the if we can just encourage you, and I noticed everybody kind of paying attention to today, if they pull the mic when they are going to speak, the system works really well. He also told me that Tim DeForge in here, who operates the equipment, does try to adjust the volume and things. If a person is a low talker or speaks away from the mic or something, he tries to adjust that. But then, of course, you get a blast from the next one if he doesn't turn that down. So he's working within that. So we'll just try to probably positively encourage you to move a little closer to the mic, or if we have a guest, that they speak into the mic. So we'll continue that. One of the meetings that I attended was the financial planning. I think the commissioners have covered that very well. I think it is moving forward real positively, and as Commissioner Campbell and Wayland have indicated, if we look at all of our options and we look at the timing of things, we will attempt to make this as painless as possible on the taxpayer. And there is no quick fix here. This is something that's going to take place over 4 or 5 years to put everything in place in order to make it as painless as we possibly can. But I think we're approaching it in the right process, and I've had real good input from the commissioners on that. And as in the other issues with the budget, I think Commissioner Campbell hit it on the nose, that they're reporting from their committee that that position is needed, and certainly no motion on it until the budgets are approved, as we did with everything else, but there's encouragement that that position should stay in there. I thought we had a very good meeting. It was 97,000 pounds, Commissioner Everett. I just looked at the bill. And it was kind of interesting. We thought they were going to talk about wanting to increase the weights, when in fact it was just the opposite. And they were very honest with us. This is about economics, and it's saving the roads and competition and different things with the railroad. So we thought it was very, very good. And for the other commissioners that probably weren't aware, our solid waste manager is planning on retiring, and Commissioner Campbell and Commissioner Everett, who are on the Solid Waste Advisory Committee, and myself met to talk about some of the things there. So we'll progress with that down the road too. Attended the diversion meeting, the administrative meeting, and I think you're all aware of this, but the environmental assessment was signed by the Corps of Engineers, and they rendered the fact that there would be no environmental impact to this area with the building of the levee dam and
Did they look at my area?
Yeah. But I just wanted to make sure everybody was aware of that they came out with that ruling. Yeah. Okay. I'll visit with Commissioner Gross in regards to, did you visit with Mr. Klein in regards to coming into the board sometime? Okay.
When they get the plan together.
Okay, great. We'll coordinate that with you. Next Monday, I did forward an email to the commissioners in regards to Commissioner Zeller. That's the commissioner of the DOT from Minnesota, is going to be at the Yumcomp Center from 5 to 6:30. I will plan on attending that. And I think I also forwarded an email from Lisa Jetvig over at Holly that on Wednesday at 10 o'clock in the morning there is going to be a groundbreaking ceremony out there with, oh boy.
Pretext.
There you go. Thank you. Pretext. And then just a little bit of a quick update on the wind towers down in the southeast corner of the county. They're going really great guns. I'm going to run down there one of these days. They say the bases have been poured and they're just moving along like crazy. They're putting up towers, and we expect those towers to be, they expect them to be up by the end of the year, which is...
I just heard Thanksgiving they're predicting, actually.
Yeah, well, I gave them a little extra time.
They got some of the bases are up.
What's that?
Some of the bases of the towers are up.
Yep. They're really moving. I haven't been down in that area. I plan to go soon and take a look at that, so...
Excuse me, Brian, could you tell me what day that the commissioner was going to be here?
That is next Monday.
5:30. 5 o'clock.
5 o'clock at the MCON Center. And that's it, Mr. Chair. Thank you.
Jenny, anything from you?
No, thank you.
Gentlemen, anything else? We are adjourned.